Hello everybody, and today with me I have the lovely Jackie, who has travelled to Glasgow from Aberdeenshire. I believe, Jackie, you set out about nearly 6 in the morning and got here by about 3:30. Honestly, for us, that's an amazing, acknowledgement and gratitude for you coming all the way down here. So even before your treatment started, you obviously spent a lot of time coming down here. Why choose to come to the Dr. Ahmad clinic in Glasgow?
So I've been considering this treatment for quite some time and I did go to a couple of people up in Aberdeen. I didn't feel 100% confident, so I started to look around and your name came up as somebody who was amazing. I read the reviews and there's 100% people say that they've got every confidence in what you do with every procedure. So, from beginning when I spoke to you on the phone, I felt really safe. I understand, because you explained what could go wrong, and I understand that, and I've processed that, but I think I've got every confidence in you and that things won't go wrong. So
thank you very much, Jackie. So everybody, just sort of following on from the kind words we've had from Jackie here, and obviously a great honour for us with someone taking the time and energy to travel down. So very humbled by your confidence and also all my patients that have given me all the lovely reviews. The plan today is going to be, just as discussed, we're going to be dealing with ptosis of the face, which is sagging the lower face. And so what we'll do is we'll just have a quick run through of what our plan of action is, what we're planning to do, Jackie, for you. And we'll probably be taking some pictures with our 3D camera before, some pictures afterwards, and you know what that'll do? It will show us exactly how much you've lifted and where you've lifted from. Okay. So just as discussed earlier, Jackie, our concerns again were along the lower face, etc. here. Now, when we are doing the lower face, there's two elements. There is the sagging due to the tissues coming down, but in addition, there is sagging due to the tissue in the centre of the face coming down. Usually what happens is in the centre of the face, we lose our natural fat pads. And when these fat pads go, and they just go with age, the skin that's nice and plump over it comes down and causes an element of sagging. And then in addition to that, naturally we have sagging. So the plan of action would be in your cases, we would want to do a replacement of the mid-face volume, and also we want to do the thread lift. Initially what we're going to do is we're going to do the lift and see how much you come up. Thereafter, what we will do is when we come back in for a review, we can then have a chat about, look, how much do we need to replace? I normally do a review after 4 weeks, and the reason for that is I don't think a thread lift is a simple procedure. There's fine tuning when you come back in, a little bit here and a little bit there. So what I say to my patients is, look, you're coming in for your lift. So it's not a case of so many threads now and so many, we just don't do that. You're in for your lift, it all settles down, and sometimes, yourself, for example, funny, this side and this side is so different.
okay.
You understand, and that's natural. And everybody has the two sides are different. So we'll do a lift, etc. And you come back, and you'll be very critical. Doc, I think a bit more, and if I agree with you, we can normally pop in one or two and sell those threads and lift it up.
Okay.
At that point, we have a great idea where it's going, and then if we need to, we can replace the lost fat pad. And you have two options. You can either use dermal filler, or you can use your own natural fat. I always say to patients, using your own fat might be quite invasive. A bit of dermal filler, and it's not about big lips and big cheeks. No, this is a very technical placement of deep fat pads that I've gone and replaced, so nobody really knows you've had it done.
No.
So it's like, I call it the fine tune of youth. Whoa, and you're looking fresh, you're looking natural.
Yeah.
It's turning the clock back. It's not about oh my gosh, look up here. No. It's not, it's very it's a very subtle, natural replacement, but the most important thing is it scaffolds the skin from where it's come down, which assists with this lifting, etc. up here. Yeah. So what we're going to do is, we've got our camera, And we're going to start taking some pictures in 3D format. We're also looking to look at collagen, your wrinkles, your sun damage, and everything else. And then what we'll do is we'll get you prepped up, have a couple of pictures of you before, and then we'll have a couple of pictures of you afterwards. So we've done the markings just now, Jackie, and now what we're going to do is we're going to lie you down, we're going to sterilise the area, we're going to scrub the area, put in some local anaesthetic, and then pop the threads in. I think as I've explained to you, I've just shown you the mirror. Have you seen the two sides are very different?
Yeah.
Because normally what happens is you've done a treatment and they go, oh, this is higher and this is lower. So it's nice to show them that this is higher and this is lower before we started. It's been like 2 years, Jackie. One's out and one's flat. It's quite normal to be different. But it's nice that you're aware of it. So when we do the treatment yourself, we'll show you the pictures and we'll modify accordingly.
Okay.
The treatment plan, okay?
Yeah.
So, good to go?
Yeah.
Can I scrub up?
Sure.
Fantastic, thank you. Right, Jackie, post procedure, we've just had this a bit of swelling up here, but have a look.
Wow. Goodness. What a difference.
Right, so here we go. You're going to have, because we've got the local anaesthetic in, you will have a drooping of your mouth for up to about 3-4 hours. You've got some swelling here, a little bit of bruising, ice packs tonight, and then from tomorrow onwards, hot pack to dissolve it. And that'd be quite normal after the thing, but yes, what a beautiful lift.
I know.
Yeah, so we're going to get you back here, just sitting back here. Great. Jackie, this is your before and after. And this is immediately now. You've got to remember that after the procedure, you're going to have some swelling.
Yeah.
And particularly, you've got swelling more on one side than the other, which is actually going to make the jaw look a little bit lower. Once the swelling settles in a couple of weeks, and then you're back in 4 weeks for your follow-up, you'll get a proper result.
Okay.
But even with the swelling just now, just on the side here, on the left side, you've lifted 12 millimetres there.
Gosh.
Yeah, that's 12, so it's 1.2, so it's split that much.
Oh my goodness.
And then on this side where you've got a lot of swelling, 8.89 and 9.38, and there's a point earlier on here. So you've lifted 9.38, and that's with the swelling. Look up here, you've lifted 10 millimetres on that side. So that's a centimetre, that's about that much, and that's with the swelling. And you've done 1.25 on that side there as well. And that will all improve. See up here? And what we'll do is we'll do that back.
Yeah.
So we'll see you back in 4 weeks' time.
Okay.
Prescription for the aftercare. Here's the antibiotics. I've written it at 1 tablet a day for 3 days.
Okay.
The aftercare sheet will be emailed out to you, but the important things that I've said, there will be no dental treatment for the next 8 to 12 weeks.
No.
No heavy train or no stakes for about 2 weeks. So that's fine.
So how do I get the
So it's a private prescription, give it to the chemist, they'll dispense it for you,
Right.
and that's fine.
Okay.
Okay?
Yeah.
Thank you very much.
Thank you.
Pleasure.